So I haven't been making a lot of videos lately, in part because I've been struggling with a really bad bout of tinnitus. For those unfamiliar with that term, that's ringing in the ears, and it's specifically when it's not actually a sound happening outside of your head. And if you're interested, let me know in the comments below. I can talk a little bit more about the different types of tinnitus, but right now I'm going to rant a little bit about how badly we understand this disorder and how much we don't have treatments for it. And I actually did a video about this almost exactly 1 year ago, talking about a potential new treatment. And I don't know where that is, but I might be searching again for it to see if I could get signed up with a trial if this doesn't go away soon. And I think in part why it's so difficult to treat is that it is a complex disorder that involves neurological changes and psychological ones that go with it. Because one theory for what's happening is that when you start hearing that phantom sound, some brains, for reasons we don't fully understand, start to sort of target on it as important. And therefore, instead of getting rid of it like we do for most background noise, actually starts to attend more to it. And then as that annoys you, you're attending more to it, which is sort of teaching your neurons to say, oh, good job, do that even more, and then it becomes more and more prominent. Then as the anxiety and irritation continue, we get a positive feedback loop where it gets louder and louder and louder. And so the treatments typically focus on two areas. The first, the main one, is helping patients stop attending to it and attend to other things instead to try and get rid of that positive feedback loop. And the second, which is less common, is address what the underlying cause was, because that requires figuring out the underlying cause. Now, in my case, there's a chance that a medication I started taking somewhat recently, a few months back, has this as a very rare side effect. So we're going to see whether or not removing that helps with the tinnitus. But for so many out there, there isn't a clear solution. And if you have a friend or family member who is struggling with it, please understand how distracting it is, even though from the outside, it is once again an invisible disability.